Okay, I think we're live. So, welcome to another episode of Three Plastic Surgeons and a Microphone. Except right now, we have two plastic surgeons and a microphone because our third, Sal, is either going to show up and as Sam said, a rolling start with our show, or maybe because we're starting on a Saturday, he may not show up. I don't know. We'll see what happens.
Yes, this is a different time for us, and it's very possible that we even fooled him with our start time. So, hopefully, Dr. Pacella joins us, but we'll get started in the meantime. Thanks for the introduction, Dr. Rhee. I'm Sam Jejurikar. Dr. Rhee has a few basic introductions that we need to get through before we can start with the meat of the show.
Sounds good. So, the three plastic surgeons are, as Sam said, Dr. J, Dr. Sam Jejurikar out of Dallas, Texas. His Instagram handle is at Sam Jejurikar. And then also our absentee plastic surgeon who should be joining us hopefully is Dr. Salvatore Pacella out of San Diego, California. His IG handle is San Diego Plastic Surgeon. And I am Sam Rhee out of Paramus, New Jersey, and my Instagram handle is Bergen Cosmetic. So we are here weekly, live, talking about different plastic surgery topics and anything that we have that's of interest to us. And just to start off every show, just remember this show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based on circumstances, situation, and medical judgment. After appropriate discussion, and always seek the advice of your surgeon or other qualified health care provider with any questions you may have regarding medical care. And lastly, never disregard professional medical advice or delay seeking advice because of something in the show. So with that out of the way, Sam, you look like you're in a different location this week. It looks very nice. Where is that?
So I'm lucky enough to be in Breckenridge, Colorado. Made a little escape with my family for the latter half of the week. I think, like most Americans, we were going stir crazy in our house. It's interesting when I talk to my patients, when I talk to my family, when I talk to my friends, everyone is losing their mind. Everyone is going a little bit stir crazy. And so a place where we thought we could get away and sort of visit nature was Colorado, which is a place we like to come to all the time. And so it's nice to get away. It's nice to escape the Texas heat for just a few days. But COVID is still on our mind, just like it is on everyone's mind everywhere in the U.S. How was your week, Dr. Rhee?
It was good. I didn't travel. Hopefully I'll be able to get to the shore in a week or two. Here in Jersey. It's been busy. We just haven't been affected as badly as some of the other places have in the country. But the issue really is that everything is still on hold. We haven't progressed in terms of opening more things. We're still adjusting to everything being outside. My kids are playing contact sports outside for the first time this week, which has been different. I guess that's been good. But from a healthcare perspective, the worst thing right now is you mentioned last week how your tests are getting delayed, the results. Our COVID tests are now crazy delayed, like more than a week in some cases, and it's been very frustrating. So that's what we're dealing with.
In fact, I just read in the Wall Street Journal this morning that CVS, which is one of the nation's largest providers of COVID tests, is now taking them greater than 10 days to get results back for some potential patients, which is tough because people are supposed to quarantine after they get the test until they get the test results back. But if people lose their symptoms and they don't know, human nature is that they want to get out and do things again. And so, it seems like every week we talk about COVID and we talk about how, this is supposed to be it's not three plastic surgeons talking about COVID. It's three plastic surgeons that are supposed to be talking about plastic surgery, but you just can't get away from it in all aspects of society.
Yeah.
It was interesting for us traveling out here this week because, I'm very proud to live in Texas and consider myself a Texan, and we're all about civil liberties. But this is a tough situation to be in where you try to balance public health demands and civil liberties. So in our state, we have a statewide mask mandate, but there are exceptions that can be made in certain counties. And there are still many people that are against masks. So on our flight on the way out here, it was interesting. My family is ultra protective about things. We were all wearing masks and even face shields, which got us a bunch of strange looks. But then when we get to Colorado, where people are, much more concerned about, it seems like on average, not trying to pinhole people, but people were much seemed to be in general as a population more concerned about COVID. Everyone was wearing a mask, and so I think I sent you a couple pictures.
Yeah, let me put up your. She's the cutest kid.
So this is my 3.5-year-old Julian, who is demonstrating that even a 3.5-year-old with almost no impulse control of any kind can mask for an entire flight, can wear a face shield for an entire flight. I think he was lucky enough to be borrowing my wife's phone and was watching Cars, and with proper distraction, he could keep it on for the entire flight. And so it's frustrating when you see patients and adults who complain about wearing a mask or say that it's too hard to wear. I mean, literally a 3-year-old can wear it.
And he looks very cute doing so too.
Yeah, well, that's just his baseline. He looks like my wife, luckily, so he's far more attractive, I think, as a human being than I'll ever be. But it's easy to wear a mask, and there's some data that's out that shows that if everybody wore a mask and did it for the next 4 to 8 weeks, we could get a handle of COVID and probably get back to a much more normal life. Other thing that I find interesting is I think I sent you one more picture with my older 2 kids, and this is not meant to be a slideshow of my family, but everywhere we went on the hiking trails yesterday, everyone was wearing a mask. It's a law in Colorado that's being followed closely and being enforced very closely. And even out in nature where we're far away from people, every person we encountered was wearing a mask. So wear your mask, people.
I agree. Well, first of all, thank God your kids are better looking than you are. That's very
yes,
that's a bonus.
Yes, and they thank God for that all the time.
The second thing is it's kind of gotten a little politicized, the whole mask thing. And listen, I understand if people don't want to wear masks, that's fine. I mean, I'm not going to sit there and arrest someone or try to arrest someone or get into some sort of altercation with someone if you're not wearing a mask. But I feel like you do that we are science-based people. That's what we do for a living is we provide medical care, and that medical care is based on science, and that science is what guides what we do, and it guides how we manage patients. And the science that we've seen so far shows that mask wearing, like you said, helps. And so I don't want to get into a debate about it. I will never sit there and yell at someone if they're not wearing a mask. But I do know that, like you said, mask wearing helps, and the faster we can sort of get through this, and the better. And I think that it can only be helped by wearing masks. It's not going to hurt us in any way.
Yeah, I mean, we all want life to go back to normal. You do, I do, every person out there. But we have to go through this period of time where we wear masks so that we can truly go back to a COVID-free society. So enough about COVID for the week.
So agree with you. All right. So let's move on to our talk for today. What we're going to talk about, which I'm pretty excited about, is 10 things to do before plastic surgery. So basically, if you are someone considering plastic surgery or you're scheduled to have plastic surgery or a cosmetic procedure, what is it that you can do to help yourself ensure the best outcome and a successful result? Any thoughts before we start going through these topics?
No, I think this is a great topic to get our perspective on it. Mainly because I think patients, what I've noticed now, and I know you've noticed this as well, now compared to 10 years ago, they use the internet so much more than they ever did. And being able to get a plastic surgeon's perspective on things rather than, merely just patient perspective is a nice adjunct to what's out there. I don't think we're the definitive source, but I think our opinion matters as much as, if not more so, than patient sites as well. And so I think it'll be good to do this, and it'll hopefully, if my patients watch this, it'll save me a lot of time in consultations too.
Yes, I agree. I mean, but all of us have had years and years and years of working with patients, and we understand that patients have sometimes preconceived notions, things that they have, like you said, heard or read. And listen, sometimes it just helps to remind patients of the things that we know can really help to get a good outcome. So let's start with, and these are in no particular order. I just we threw them all together. Not one is more important than the other. So the first one is do not bankrupt yourself or place yourself in financial distress for your procedure, but also do your research because you get what you pay for.
Yeah, I think that's both plastic surgery advice and also life advice. Um, what we do for a living with aesthetic surgery is a discretionary expense, meaning nobody has to have plastic surgery to look better. It's something we're choosing to do to make ourselves feel better about our lives, to feel better about the way we look. But you have to be in an appropriate place to do so. It's expensive to get plastic surgery. Um, this is Dr. Pacella trying to call us, so hopefully he's trying to get on right now. Um, I won't put him on blast, but maybe we could just maybe we could just message him to get him on to
All
get him
right.
online. But to sort of um, to just follow along that line, plastic surgery is expensive. Save appropriately. Make sure you can afford it. So there are financing options that are available. Many of my patients use Care Credit, which is the largest sort of third-party plastic surgery finance company that's out there. They make it so that it's affordable to get plastic surgery. There's payment plans that extend out over 5 years so that you can fit it into your monthly budget. That being said, like Dr. Rhee is saying, if you try to go for the cheapest option, particularly if you try to travel overseas, you're going to have problems sometimes, particularly if you have a complication. Complications are unfortunate, but they happen in plastic surgery. And the person that's going to be most invested in taking care of you is your plastic surgeon. And so making sure that you're going to a board certified plastic surgeon who is either close to you or easy to get to, or who can at least communicate with you frequently is going to be really important. And so you need to do your research. You need to make sure you're getting a qualified person, which is going to be expensive. But at the same time, you have to make sure you can afford it.
Right. I agree with you 100%. This is an investment, and as Sam said, it is discretionary, but this can be a very powerful change in people's lives. And if you're going to make that sort of change to yourself, two things. One is you're not going to spend everything that you have solely for this thing. You're going to work it the you're going to work it into your life in a proper way so that it is not negatively impacting every other aspect of your life, just like you would for any other major decision that you made. If you blew your money on a Rolls Royce and you had no money to pay for food or your rent, then as much as you would get enjoyment out of that Rolls Royce, you're going to have a lot of stress in your life. And that's sort of the same thing with plastic surgery. You have to be in a position where you can truly make a positive impact in your life, but it's not going to be negatively impacting everything else. In terms of, and that's why you're going to get someone who is worth the money that you're paying for. All of us know different plastic surgeons. We know that not all plastic surgeons are the same. Some are better at certain things than others. Some are going to match up better with some patients. So you're going to need to make sure you pay for, and no one who's good is going to be cheap. Um, so make sure you find the person that is right for you, someone who is board certified and someone who has experience in the type of procedure that you're interested in. In terms of finance, I don't know about you. I am a care credit provider. I just recently sort of started dabbling in it. I remember our bosses back at Michigan used to say, I don't know if you ever heard this from Kuzan, but he used to say, listen, you should only borrow for a couple things: education, car, house. If you have to borrow money for groceries or for clubbing, you're in a bad situation. And I think that that's very conservative advice. I do think that some of these financing options can provide people some flexibility as long as they're responsible in terms of using those financing options. I do think it is better to finance than to say do some other things in terms of your money. So I agree with that, but I do caution people to really look into the terms and make sure that they're not getting screwed over.
No, I think you're totally right. Obviously, like I was saying, like the things that you mentioned, education, a home. What was the third thing you said?
Car.
Yeah, I'm not even sure about the car. I would agree with education and a home. Those are things that we need to better ourselves in lives or to have shelter. Plastic surgery is in that same category as sometimes as like a nice car. It's something you want. It's not something you necessarily have to have. But everyone's financial situation is different, and many Americans utilize credit. And so it's not that I'm trying to tell people that they should put their plastic surgery on layaway or they should get in a bunch of debt to do this. Far from it. Many people know what their monthly budget is. They have a better sense as to what their cash flow situations. Look who it is.
Hello.
Dr. Pacella.
Hey guys, my apologies. I had some technical difficulties.
No worries.
No worries. No worries. So we had started our list, Dr. Pacella, about kind of 10 things that you should do before plastic surgery. And we're on the very first one, which is basically don't make yourself bankrupt to have surgery, but also do your research. Do you have any insights into that, or sort of what you tell your patients in terms of what they can afford and how they should approach surgery?
Well, I think it's important to understand, your resources. I mean, it's interesting. Patients will pay, come in with a Louis Vuitton bag, but not want to pay for, a breast augmentation. So I think if you have the money, you want to just figure out what's important for you. But I agree with that. You do not want to financially bankrupt yourself, because this is stuff that's only going to catch up with you. On the same token, I think it's important to understand, you have, if you have certain resources, what's going to last you longer? Is a breast augmentation, tummy tuck, going to last you your lifetime? Yes, most likely. Some physical device, or iPad, iPhone, things like that, they're not going to last your lifetime. So it's just a matter of getting out what you want.
Agreed.
Perfect.
All right, let's move on to the next. Sorry.
I was going to say, I feel like we should ask Dr. Pacella how he's been. We haven't seen him all week, and it's straight work mode. I'm willing to take it.
It's just been a busy week. We, really ramping up surgery, and just been busy all week long. It's been crazy. How about you guys?
We're good. I'm on a little break right now, so
yeah,
I'm nice and relaxed. But we're good.
Yeah. All right. So the next item is do not buy too much paraphernalia. If you, as you said, social media is one powerful tool for patients. But I have seen patients that have bought or were told, you have to do this, you got to do that before, you have to get this afterwards. And sometimes it's not that relevant to what that patient's needs or even procedure is.
Yeah, I totally agree with that. Patients buy a lot before surgery, and a lot of things I'm not even sure why they're buying, but they got it from a Facebook group. And so I'll do a liposuction case or a Brazilian butt lift case on someone, and before I've even done the operation, they've already bought like 6 different garments. And I think going slow with it and talking to your surgeon is key. There is some use for paraphernalia for sure that you can buy for various operations, but the offices of your plastic surgeon should be able to help you. For each thing, there's 1 or 2 or 3 things that's really, really useful to have. You don't need to overload yourself with, $1,000 and useless items just in the off chance you might need it.
Right. And chances are your surgeon's going to have all this stuff anyway for you. I know in my practice, we provide bras and liposuction compression garments, abdominal binders, things like that.
Yeah, and I remember one time I had a patient with a tummy tuck, and she was told from her Facebook friends to go get these ultrasound massages right after the surgery. And after about 2 post-ops, I noticed that the center lower part of her abdomen was starting to get dark. And she ended up actually getting skin necrosis and some death because whoever she went to was just, pounding the heck out of her abdominal flap with these ultrasonic massages. And if she had talked to me about it, we ended up having to debride it and do all sorts of treatment for it. She could have avoided a lot of problems if she had just talked to us about it beforehand. So
I agree.
All right. Next, actually read and follow the instructions from your surgeon, both before and after care instructions.
I don't know about you guys. We do tend to inundate our patients with a lot of information. And I understand their desire not to read it. It's a lot, but it is worth the time. Most of the questions, at least 95% of the questions that you'll have, are actually in the information. And we also have follow-up information that we give them, like each of their post-operative visits, to try to keep them on track. If you follow that, and then if you have questions about things you've read, it's more than okay to bring it up with the office. But reading and following your surgeon's instructions are going to be most important, because every surgeon does things a little bit differently. And as a result, there's going to be nuances in how they manage their patients afterwards.
Right. I think, in my practice, we have a subset of patients that will read everything, and then a subset of patients that will read nothing. And I think the important thing is, as a plastic surgery office, as a nursing staff, clerical staff, it's very important, I think, to give the highlights of what to take care of, what to do, and then remind patients that, hey, we have a pamphlet here, we have a information book. You want to read this at your leisure. So that's an important reminder for us as a provider to have all this. Yeah.
I agree with Sal. There's two groups. It's the ones who try to put together the IKEA furniture without even looking at the instructions, and then the ones who read it 5 times beforehand and then proceed. So, yeah, I think you're both right. Just try to follow what it is, and we try it. Like you said, there's a lot of information. As an office, we try to at least hit on the high points verbally and make sure that they're aware of the most important things. But yeah. If you can read it, it's going to help everyone a whole lot. Number 7, quit smoking or any illicit substances months before, and be honest and tell your surgeon.
I think this might be the biggest thing and the most important thing. Is that what you were about to say, Pacella?
Yeah, go ahead.
Yeah, smoking. You get a lot of information from a doctor's office, and it's hard to prioritize what's the most important. This is probably number 1 on the list for me. Smoking causes huge problems in cosmetic surgery, and just because you may have gotten your gallbladder taken out or your appendix taken out and you were smoking and you were fine, plastic surgery is totally different. We lift up skin flaps, we divide blood vessels, we move things around. It's much more susceptible to major wound healing complications, and even a trace amount of carbon monoxide, nicotine, tar, benzene, like 30 things from cigarettes, can cause profound problems with little blood vessels within your skin, cause the skin to necrose or die, and lead to terrible results. And so my general rule is don't smoke at all, and don't use any replacement nicotine products for at least 4 weeks before your surgery. And if you cheat, tell us. It's better to screw up your schedule than to get a horrible result from a completely elective procedure.
Yeah, I agree. I was just going to ask you both, like, what your criteria is for being off of cigarettes or nicotine prior to surgery. Samir, you said 4 weeks. Jersey Sam?
I think usually 4 to 6, if they're honest with you. That's a big if.
Yeah, I have a little special criteria here. If you read some of the literature in plastic surgery, some of it is as short as 2 weeks. And I can tell you, I think that's just not enough. I've seen patients for cancer operations that have quit for 2 weeks ahead of time and had massive problems. So, my criteria is really 3 months of being off of any nicotine products. And what that tells me is, they've really actively quit.
I mean, I've known some surgeons that will drug test for nicotine pre-op, and I have not done that. But I do feel like most patients, if they are really truly addicted to smoking or nicotine, it's a really hard habit to quit. It's harder than probably most. And I will say that most patients that I have seen that are truly addicted, it is very hard for them to quit. They will fudge. They will tell you, I'm down to 1 every other day, or, listen, if you're smoking and you're, even if it's 1 a day or 1 every other day, just let your surgeon know and let them make that decision for you about what is safe. If you can't quit, you shouldn't be undergoing a cosmetic surgery procedure. I know people who have asked me, should I be should I be eating too much broccoli because I've heard that causes inflammation, and then smoke. And their priorities are not right. If you really are going to spend this kind of money, then do the right thing and get that nicotine out of your system.
Yeah, and that's just to be clear to people listening. That's not just cigarettes. That's e-cigarettes. That's smokeless tobacco. That's
Gum.
patches, gum, all of that stuff. And even if you are using an e-cigarette and it says it has no nicotine in it, do not believe it. It's not regulated. It's still harmful from a wound healing standpoint. And like Sam said, talk to your surgeon. Not all operations are the same. You know, my concern with a facelift or a rhinoplasty might be different than it might be for a liposuction case. But having that dialogue is going to be very, very, very important to appropriately assess risk before your surgery.
And there's probably even more nicotine per dose in nicotine gum than there is actually in cigarettes. You know, it's an exceptionally powerful dose in gum.
Agreed. Some of the people I've seen trying to quit say that it's too strong, and they've had problems with some of the like alternative methods. So yes, you're absolutely right. So, all right, number 6. So set up your home properly. That means sort of like nesting. Stock up with your pre-planned meals, the fruits and vegetables, the stuff that will be easily sort of digestible. The stuff that will help you with recovery. Maybe having a recliner, a recovery area, maybe an area in your living room so you don't have to go up 3 flights to your bedroom. Basic dressing supplies, all the easy stuff that will make it easier for you to get around during your recovery period.
Go ahead.
Sorry. Patients oftentimes ask this specific question. I have stairs in my house. I have stairs leading up to my condo, stairs in my home. Do I need a wheelchair? What should I do? Should I stay somewhere else? And, stairs are good, particularly if you're having body surgery or abdominoplasty surgery. One of the risks we have with a big, long body case is the risk of DVT or blood clots in your legs. And having stairs in your home is a good thing because we want you to get up and move and use your legs and step up and down. We don't want you running stairs. I think the important thing to understand is you don't have to set up your home exactly right. You could set up a few things, but you don't have to move out of your home. But it's important to make sure that you have somebody there to assist you with going up the stairs.
Yeah, it's funny you brought up the stairs. I get that question all the time too, and I've never had that good of an answer to it. But it's so true. There's nothing wrong with stairs at all. The patients are deathly afraid of going. I mean, I get that question once a week probably. I think another thing that you just said that's so important in the setup of your home is making sure you have somebody to help you. Sometimes people don't want to inconvenience their friends or their family, and that's fine. There are services out there that you can hire to have somebody help you. But if you think you're going to have a big cosmetic operation and then take care of yourself, it's going to be very difficult, and your outcome is going to be a lot worse. And the risk of a blood clot, because it's just hard for you to get up and down, is going to be substantially higher.
Agreed. That's actually one of the other ones is having appropriate support.
I blew it.
No, it's good. So we'll cover it now. But I agree 1,000%. I think Sal's patient, Elaine, had mentioned that there are services available that can help you with certain things during recovery. And, especially my patients who live in New York, in Manhattan, they're all very isolated. And they for such a big city, they don't necessarily have neighbors or people that they can rely on. And you're right. Sometimes it's not so much the setup, but it's who's going to help you with that setup that makes it more important. Okay. All right. Review which medications to take or not take beforehand.
This is exceptionally important, particularly if with our older patients. Many medications that are out there can cause excessive bleeding. Some patients are on blood thinners, which can be unfortunate for plastic surgery. And in my practice, the most important meeting we have with patients is something called a pre-op appointment. That pre-op appointment is done hopefully about 2 weeks prior to surgery. At that time, myself and my nursing staff will go over exactly what medications to take or not take. We have a full list. So it's important to really bring that to your pre-op appointment. It's important to understand exactly whatever you're on. And, sometimes for example, our younger patients may have a workout or something and they will forget and they'll take a handful, or a couple tabs of Motrin, say, and that can lead to significant bleeding after surgery. So I think the onus many times is on us and the plastic surgery staff to understand or have patients understand exactly what to take and what not to take.
Yeah, totally agree with Sal. We don't do a formal preoperative visit for many of our patients, but we review it all online ahead of time. I think, again, depending on the procedure, the relative risk of certain medications changes, but sort of the big classes of medications that we worry about are blood thinners. And those aren't just prescription blood thinners, because those can be aspirin. Those can be non-steroidal anti-inflammatories like Motrin, like Dr. Pacella was referring to. Another big class is weight loss medication. A lot of patients like to take phentermine, and there's a lot of potentials that can cause from a cardiac standpoint with anesthesia. And then over-the-counter supplements. Most of the over-the-counter supplements that you buy for your general health aren't really regulated. And so there can be a lot of things that cause bleeding complications in some of those supplements. So in general, if it's not completely necessary or recommended to you by another physician, we have you stop taking those too.
I agree with both of you. I think I see a lot of patients on phentermine, the weight loss medication, which is surprising to me a little bit. The contraceptive medications, birth control pills, that's a big one. The herbal supplements can be an issue. I usually am okay with stuff like arnica because a lot of people want to take that. What do you feel about some of the other things that people want to take before surgery?
Yeah, in fact, for a lot of patients, we'll actually recommend they take arnica and bromelain to help with post-operative bruising and swelling, and I'm more than okay with that. And for before I get to that, certain non-steroidals I'll actually use for breast augmentation, for instance, like a different class of non-steroidals. But in general, things like ginkgo or St. John's worts. They can have an issue with bleeding. For most operations, I'm not that worried about it. But for facial aesthetic procedures, rhinoplasty, blepharoplasty, that sort of thing, I do want them off of it for 2 weeks ahead of time. How about you, Sal?
We have a list of all the over-the-counter, natural supplements and things that we don't want you to take. And I've had a little bit of an interesting time with arnica that for some patients it works really well. For other patients, it just doesn't seem to do anything. So, I think I tell patients, if you want to take it, that's great. I don't necessarily recommend it or not recommend it. I don't know. What's your experience with arnica, both of you?
Mine's the same as yours. Sometimes it helps, sometimes it doesn't. It's relatively underpowered, but it's a nice little adjunct.
Yeah. I've seen some anecdotal experiences where it seemed to make a huge difference, and then, like you said, sometimes it doesn't seem to make any difference. The only other thing I was going to add, I forgot, was I'll see a lot of younger women with borderline low hemoglobins or slightly, just a little bit anemic, and usually it's because of heavy menstrual cycles, and so it's helpful if you can get them on some iron a month or two beforehand. That seems to help with recovery. So I try to push iron supplementation for a lot of patients. They don't like it because it may make them constipated, but I think for a lot of patients it may be helpful.
Yeah.
All right. We already talked about it. Arrange for help afterwards. If you have children, pet care, just care for yourself, going up and down the stairs, transportation. Anything else to add for this one? I know we covered it a little bit.
Not really.
Okay. Don't party before your surgery. Don't party before your surgery.
I think you specifically mean don't use a lot of alcohol or illicit substances before your birthday. Before your surgery. Birthday's a different issue. And that's true. For a lot of the same, alcohol can cause problems with bleeding during surgery. So, most of us have in our preoperative directions for patients not to drink for a couple of weeks ahead of time. And there's a reason for it. It's not that we're trying to be draconian or try to take away your lifestyle, it can cause problems with your surgery. Surgery is not only a big financial investment, it's a big time commitment as well. And it's not just the actual surgical procedure, it's the planning ahead of time and getting ready for it. And so, not smoking, not drinking, not using illicit drugs, all very helpful to help prevent complications.
Yeah, and I think the important thing with alcohol is it can cause a significant amount of dehydration. And when you're undergoing general anesthesia, you're sleeping, you go to sleep. If you are exceptionally dehydrated, like alcohol can make you, particularly the day after a night out, that can cause significant problems with blood pressure. It can be very difficult for the anesthesiologist to maintain. So hydrate yourself, but not with alcohol.
What do you think about partying afterwards? I do have patients who ask when they can start having a glass of wine or two after procedures. And also, wasn't there a plastic surgeon from Texas who used to brag that his patients would go out dancing after breast
Yes.
dogs?
Yeah, it's a big marketing thing, a 24-hour breast augmentation. And John Tabbitt's made that popular, and it's been sort of passed on to other surgeons who advertise a 24-hour recovery. And it's a marketing thing. I think most of our patients have close to the same 24-hour recovery where they feel pretty good after 24 hours. But I generally, it really depends on the operation. For facial cosmetic procedures, I ask people not to drink for 2 weeks afterwards. For smaller procedures, whether it's liposuction of a small volume or a breast augmentation, I might be fine with it after a week, provided they're off all their pain meds. But it's individualized for every procedure, and it's important for every procedure. Just the relative extent changes a little bit.
Right. I couldn't add anything more. I think when patients are off of their pain medication is when I say you can go back to 1 or 2 drinks in the evening if you like, but no partying for a couple of weeks.
At least not the kind you do. So
I know. I'm a cheap date. I have a half a glass of wine and it's
put you down. Yeah, see, we're getting older. That's why. All right, number 2, arrange for the appropriate time afterwards. So depending on your procedure, you may need days or weeks. It's not just the initial aches, pains, or bruising, but other restrictions that you may have after your procedure. If you work, can you afford to take that time off of work? That includes stay-at-home moms, that sort of thing.
right. And I think it's important for us, as the provider, to really hammer this down with patients before surgery, because some patients just don't have a realistic expectation about what amount of pain or discomfort they're going to be in. Some patients with a heavy surgery, say a mastopexy augmentation, a tummy tuck, they'll have a surgery on a Friday and expect to be back by Monday. And I just don't think that's very realistic at all, obviously. But for some procedures, say a little bit of minor liposuction, it's possible to go back to work a couple days later. So the other thing I would say is we're going to have to fill out some disability paperwork or an excuse from work, etc. And I want to caution patients, it's a lot easier to ask for more time off and be released early than it is to get additional time off. It's just a lot more paperwork if you're going to add another week after. So if you have the ability to take a little bit of extra time off, we can always write you back for getting back early.
Absolutely. Yeah, and I think I would just to add a little bit to what Sal said, there's not only the physical discomfort with some of these bigger operations, sometimes you may feel great, but if you've had, say, a facelift or your eyes done, you may look terrible. And so you may have the ability to work from home and in those sorts of situations, you're going to be better off if you're actually utilizing that, because certain operations, if you have a facelift, for instance, I'll tell people, it could be 2 or 3 weeks before you look socially acceptable, even with camouflage makeup, and you have to plan accordingly. And so if you don't have that and you have an important event or an important meeting and it's 10 days out from surgery and you don't look that way, you're going to be very unhappy. And it's mainly just because of a failure to plan appropriately.
Nothing makes me more nervous than a patient who says, I want this procedure because in a month I'm getting married or I'm going to my daughter's wedding. I feel a tremendous amount of anxiety when that happens, because it always seems like the recovery is always slower in those situations. So I want to make sure that patients, if they got something big coming up, they give themselves plenty of time to make sure that they recover from that, so that we're not, stressed about, why are they still swollen or blah 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 blah, blah, like that sort of thing.
Perfect.
I don't know why this is number one. We have one bonus one after this, but this is not the most important, but it's still number one. Shaving or waxing near surgical sites 4 to 7 days before surgery, as opposed to the night before or the morning of surgery, which can increase risks for bacterial colonization.
Yeah, don't do it. Like, I'm still trying to figure out how this is number one on the
list. I don't know.
Yeah. The other thing is, we can do this for you during the before your surgery. After your sleep, we always prep the area to make sure there's no excess of hair, that it's not going to get away in the incision. So if you're worried about us as surgeons, we could take care of that for you. So
the only one thing I would make an exception to is if you are getting a hair transplantation, you may find it beneficial to do it yourself the night before, so you can shave your entire head and just not a portion of it. That's the one operation I might make a little bit of an exception for.
Texas Sam, how do you feel about manscaping, the surgeon manscaping prior to their surgery?
You mean me personally as an individual?
Yes.
I'm a big fan. I'm a big fan that surgery really has nothing to do with it. Exactly.
So maintain, for the plastic surgeons out there, according to Texas Sam, maintain your manscaping regimen.
Absolutely.
He's very smooth. He's a very smooth surgeon, for sure.
Well, I'm assuming that Jersey Sam probably is fairly hairless, given his
yes.
Yeah.
So he can make fun of this whole issue. But me being a hairy Indian and you being a hairy Italian, these are issues we have to think about.
Yeah, I'm definitely low maintenance. There's not a whole lot of hair there. All right.
It's just like, no, really, you can take off your sweater. Go ahead.
Yeah.
All right. And the last one, get in the right mindset in regards to expectations. So have a conversation with your surgeon. Don't get lulled into false expectations or things that you may have seen elsewhere or by your friends or social media.
Yeah. I think you've mentioned this before, Jersey Sam, where a patient will, who might have a BMI of 35 will come in with a post-operative liposuction Brazilian butt result of a patient with a BMI of 20, and we'll want to look like that. Everyone's starting point is different, and thus everyone's finishing point is going to be different as well. Not to say you shouldn't expect great things out of your surgery, but it's all going to be relative to your starting point.
Yes, this is of critical importance, I think. And a lot of the onus on this is the surgeon and surgical team and the expectations to explain this ahead of time. Patients oftentimes bring in photographs. In fact, in my breast augmentation patients, I want them to print out photographs of things they get from the internet to say, hey, this is what I want to look like. And that's why I think a pre-op appointment is very critical, because I'll go over those photographs and say, hey, this is achievable. This is not really in the realm of what we can achieve either. So this is of critical importance.
Yeah, I try to be relatively conservative in terms of, I don't think surgeons should ever promise or guarantee anything. And I certainly don't, but I feel if a patient has something that, and patients will often say, okay, I understand what you're saying, but still in their own mind still have something that is not realistic. It's hard to communicate with patients and get to understand what they want for sure, and know whether they understand what it is that you believe you can achieve for them. I think that's why you, Sal, have those photographs, because that really helps. I think that's why digital imaging, what Texas Sam uses, can be very helpful. Whatever means we can use to try to understand our patients and understand what they want and then also get them to understand what we think we can deliver is really important. And then if they're in that right mindset, then I think they'll definitely be very happy with the procedure.
Couldn't agree more with you, gentlemen.
All right. So that's everything that I have listed. Are there any other things that patients should do before surgery?
You know, I think this is a nice overview in the sense that there's a lot to do before surgery, but planning is important. Make sure you have people, make sure you have the necessary items that are there. Make sure you have enough time off. Make sure you communicate with your surgeon. If you do those things, that's 95% of it.
Right. And, I think the other thing I would say is it's important for patients to really decide well in advance that they are doing the right surgery for them. Many times, and again, I'm going to go back to that pre-op appointment. That's why I think it's exceptionally critical that I see these patients ahead of time before the surgery for a informal pre-operative assessment, because many times we'll go over again the surgical plan, and sometimes their expectations have changed. Sometimes they want to change what they do, and I think that's exceptionally important to hammer out ahead of time. It gives a surgeon and the patient a second opportunity to look at the plan and restructure it if needed.
Yeah, I think the key when I listen to both of you is communication, whether it's with your surgeon's office or the surgeon, or reading what they communicate to you. It's really about I will have patients who will ask the same question and call our office like 3 times in a row. But most of the time, we really encourage it. If you're not sure, if you have a question, check with your surgeon's office, talk to their staff, talk to everyone involved, and make sure that you're on the right page, because regardless of all of these things, and you might not have a lot of time. It could maybe be a week or less that you see the surgeon. It's possible before you decide to do something, and that's okay as long as you're in close communications with that surgeon and his office.
Yeah, and in the year 2020, with the current pandemic, a lot of this is possible even via telecommunication. I do a lot of these consults now in the evening via Zoom when we're done operating. Communication is now possible even when the office isn't open. And so if you have questions, get them answered, review expectations, just like Pacella and Rhee are saying. It'll make all the difference in you being happy with your results and getting exactly what you're wanting.
Very good. Wow. We finished sort of early with our talk today. Is there anything else going on that you guys want to cover?
I'm curious, Sal. You said things are ramping up for you guys right now. You guys are not slowing down at all.
Yeah, I mean, the state of California in general is slowing down substantially, but in healthcare, we are still proceeding to go forward, and again, I attribute that to the testing capabilities that we have. We've just been widespread testing. We at least at the hospital system, we have not had a shortage. We've had a little bit of a surplus for our patients. Unlike, say, I'm watching newscasts from people waiting 8 hours to get testing. So, I again, it's taking it week by week. I don't know if that's going to change, but it's been getting busy.
And what's the typical turnaround time for your testing?
Usually within about, I'd say probably about a day.
Wow. That's super fast.
That's PCR testing. Wow.
It's PCR testing. Yeah. So again, this is the testing for pre-op because our hospital rules are you have to have a negative test within 48 hours of the surgical time. So usually we're sending patients ahead of time 2 days to get the COVID test. Yeah. And then usually it's back by 24 hours.
And I think what you're seeing there is a lot of, and so I've in some of the hospitals where I'm affiliated, much faster turnaround time, because a lot of these third-party companies that are doing the testing now are actually contracting with larger organizations like Scripts for You, for instance, where all of their tests get sort of bumped up, and where individual guys in private practice like you and me, Sam, our patients get bumped onto the list. So we were talking before you got on. where even CVS is experiencing sort of a 10-day turnaround time in terms of their testing.
Wow, that's insane.
So it's sort of all over the map.
Yeah, and then like Sam was saying, and then asking your patient to quarantine during that time, it's a very, very long time. So it's been a little frustrating for us, for sure.
Yeah. Well, gentlemen, enjoy your weekend. I'm going to enjoy this beautiful day in Colorado and try not to think about COVID too much.
All right. Thanks very much, guys. Enjoy. We'll talk to you later.